Hello, everyone. Thank you for joining us today for the information session for contracted residential agency care providers. We are extremely happy you're able to join today. My name is Corey Heavener. I am with the Ministry of Children and Family Development. I am an Assistant Deputy Minister at the Ministry, as well as the Provincial Director of Child Welfare. I wanted to begin by acknowledging the traditional territory that I am on today of the Lekwungen speaking peoples and acknowledge all the territories that you're participating in from today, as well as the Métis communities. I also want to begin today by really thanking all of you for the incredible work you're doing to support children and youth in care in this province at this time. You show up every day and have been for many years. And at this time, we're facing additional challenges. And I really want to express on behalf of the ministry our gratitude for all the work you're doing to support our children in care during this time as well. One of the things that recently we've been working on is around visitation for children and youth in care. As you know, on March 26, we moved to virtual visitation only, and we paused in-person visitation. At that time and at this time, there are exceptions that can be made to in-person visitation as well. Today, as we move into phase two of the pandemic and where we're going in the coming months, and as we look at how we're going to approach restoring in-person visits going forward, we really wanted to make sure that you had the opportunity to have your questions and concerns addressed, and specifically around public health and any medical information or questions that you may have. Today, the bulletin that was put in place around pausing in-person visitation is still in effect. So we started that on March 26th, and that remains today. As we move forward, we want to take a measured approach as we restore and move into in-person visitation. So this is just the beginning. I know you have lots of questions as we move forward, and thank you so much for all the questions that you've submitted for the session today. Some of those are related to planning and how we are going to move forward together, and we will be providing answers to those in the coming days. The focus today is going to be on any of the medical health related questions that you have as caregivers and that you want answered as we move forward into in-person visitation. I also want to say thank you for what you have done for children and youth in care to ensure at this time they are connected to their families, their extended families, as well as their communities. I know prior to the pandemic that many youth were connecting and children were connecting with their families through virtual means. And over the last couple of months, as we've got used to what we're calling our new norm moving forward, there's been tremendous efforts for all of us to work together across the delegated agencies and the ministry, as well as with our caregivers and other service providers, to ensure that tools and information is in place so we can maintain those connections. Maintaining those connections for children and youth in care, as all of you know, is so critical, especially as we move forward in the days ahead. So going back to the purpose today is to really go over where are we at today with respect to the current situation, what's different from where we were in March, and specifically when this bulletin was put in place and we paused in-person visits, and where are we going in the future, and how can we go there together with the best information we have and the best approach possible so that we can move back to continuing with virtual connections for children and their families, but also building back in-person connections. So it is my great pleasure to introduce Dr. Bain Smith, who is here today to provide a bit of a background and overview of where we are today and to answer the questions that you've brought forward. I want to thank Dr. Bain Smith for her leadership. She is a tremendous advocate for children and families in this province, and I don't really know how she does it, but when we ask her, is she available? She makes that time and has been available any time that we've asked her. So I'm going to turn it over to Dr. Bain Smith to continue the session for today. One last thing before I do that is this session is being recorded. So you will be able to look at it at a later date, or for those people that were not able to make today's presentation, they'll be able to view it later. So thank you very much. It will just take a couple seconds here as we clean the headset and physical distance and switch positions.
Oh, perfect. Mute off. That's good. A good way to start. Good morning, everybody. Thank you so much, Corey, for inviting me and your kind words, as always. I share that gratitude for joining you today on the territories of the Lekwungen peoples. And for those of you who I haven't had the pleasure of meeting, my name's Danielle Bain Smith. I'm Echo Dene from Fort Nelson First Nation. I'm French Canadian and Métis from the Red River Valley. And I have the pleasure and privilege of working as the Deputy Provincial Health Officer for Indigenous Health. And I'm really, really happy to be here with you today. Just wanted to cover a couple of things during our time together today. So, as Corey mentioned, I think it's really important to reflect back and remind ourselves of where we started the pandemic in February and March. Think through how we got to where we are today, and then think a little bit about how we're going to move forward together in a way that's safe and measured. And within that, I would like to take some time to share with you what we've learned about COVID 19 in children, since that's obviously such an important part of everything that you do. So, thinking about where we were in February and March, we began this pandemic from a place of having imported cases. So, we mostly had cases that were coming from away that we were able to identify and contain and keep the spread of our curve quite low. In mid March, what changed was that we didn't realize how severe things had become south of the border. So, in the US, there was a lot of transmission happening, and we were getting a lot more seeding than we were even aware of. And so, that was in mid March when Dr. Henry and the government came together and started putting out our population health measures and encouraging everybody to keep their distance, stay home. At that time, I'm sure you recall, I think it was scary for all of us because we really didn't know what was coming. We didn't know how severe the seeding had been. And so we all watched in through mid March and late March to see what would happen with our curve. We saw that steep rise in cases. And then towards the end of March, early April, we saw our curve start to bend. And now we've seen ourselves come down to this sweet spot or flat part of the curve. And that's really a testament to how all of British Columbia came together, stood up those public health principles, and made some really drastic changes, including that physical distancing and staying home and that real slowing of the economy. What we've seen in the last few weeks is that there are fewer new cases. The cases that are being identified, almost all of them, we can trace back to a very clear source. And that means that we're identifying a lot of cases and we're able to contain them. So that's really got us in a good place. And so that's turned the conversation too, as you heard from Dr. Henry and Minister Dix last week and the Premier, into this next phase and what we're referring to as the new normal of living with COVID 19. So until we get to a place where we either have a vaccine or there is substantial immunity in the community from lots of people getting COVID 19, we're really going to have to be in this space of living with COVID 19 and creating our new normal together. So, some of the things that you heard in the announcement last week were really all about that, looking at some of the statistics and the modeling that's happened. So, using all of the data to tell us, how much can we expand our social contacts in a way that will keep us in the flat part of the curve. And I think it's really important too to remember and ground ourselves in the three overarching principles of this response to COVID 19. So, the first goal is to protect those who are most vulnerable. And we've seen very clearly across the world and here in BC that those who experience the most severe COVID 19 are people who are elderly. So, of the 120 or 30 so deaths in BC, only a handful have been under the age of 70. We definitely see the burden of illness in people who are in their 70s, 80s, and 90s. The median age for people who have died from COVID 19 is 85 years old. In BC, we have not seen any deaths in children. And that's something that we need to remember when we're thinking about who do we need to protect. It really is those who are elderly and those with chronic health conditions, lung conditions, heart conditions, severely weakened immune systems. The second goal that we have is to keep our healthcare system running. Unfortunately, we've looked to other parts of the world and we've seen examples of where healthcare systems have become overwhelmed, and our heart goes out to those areas. And so we worked quickly and dramatically at the end of March, all of us together, to ensure that we protected our healthcare system, and we did a really, really good job. Um, Unfortunately, or not fortunately, but one of the consequences of these population health measures is that it has ripple effects in a lot of different areas. And so that brings us to the third goal of our COVID 19 response, which is to minimize the burdens and harms of the population health measures. So, if we think about the healthcare system as an example, we worked really, really hard to make sure that our hospitals had lots of extra capacity, that there were lots of empty beds ready and waiting should we need them. Again, thinking back to March when we didn't know how bad things were going to get. Now we've gotten ourselves into the flat part of the curve. We're back in a situation where if we take things in a stepwise, measured approach and we really ramp up our testing, we think we'll be able to catch as many cases as possible and keep them contained. So that's a very different situation. And so that's why you heard in the Premier's remarks that we're looking to reopen and restart elective surgeries, acknowledging that there's a lot of healthcare that could wait for a little while back in March, but really does need to get up and going again to prevent other longer term consequences. So ultimately, where we are right now is in a place where we want to balance our first two goals, protecting those who are most at risk and keeping our healthcare system functioning and not overwhelmed, and balancing that against some of the population health measure induced harms and impacts and negative consequences. So I'm going to get into a little bit more detailed discussion about how we're going to do that in a moment. But first, I want to just go through some of the epidemiology, some of the science of what we've learned about how COVID 19 impacts or doesn't children. So, the first thing that's really important to note is that children don't get COVID 19 as often as adults. So, what we've seen from other places in the world and here in BC is that about 1 to 5% of positive cases of COVID 19 are in children. So, that's a much smaller number than the rest of the population. When children get COVID 19, their illness course tends to be milder than adults. So we've seen that actually a fairly sizable chunk of kids may not have symptoms at all. So up to about 10% may not have symptoms at all. And the rest of the kids tend to have milder symptoms. So um, obviously there are exceptions. There are, some kids that have been hospitalized, about 2% of kids that will need to be hospitalized. As I mentioned, there have been no deaths of children in BC, and we're so grateful for that. However, there have been deaths in other jurisdictions, but that's definitely not the norm for kids. Um, Children with COVID 19 typically will have a fever or dry cough or fatigue, but they may also have gut symptoms or digestive symptoms, which is a little bit different than some of the other age categories. So they can experience diarrhea and vomiting, and not as much respiratory symptoms. So that's how children differ a little bit. The other really important thing to consider, especially in the context of contracted residential service providers, is that children don't appear to be the drivers of this epidemic. So, in other respiratory viruses, for example, influenza, we know that kids are actually amplifiers of an outbreak. So, kids seem to be in that situation a really important source of spreading the virus. That does not appear to be the case in COVID 19. So, the majority of cases in children tend to be as a result of them being infected by an adult in their household. There's no documented evidence of children spreading the virus to adults. There's no documented evidence of children bringing the virus home from childcare settings or daycares or schools. Um, and I will say one of the reasons for that is that there aren't very many kids in daycare and school right now. So that's one of the mechanisms. But one of the other reasons probably has to do with the fact that kids just tend to have milder illness course. And then I'll just, yeah, get my next. I'm working off of a slide deck here, so I'll just bring that up. And the other thing that I just want to acknowledge, which Corey did as well in her opening remarks, is that when we think about that third goal, minimizing the impacts of population health measures, we know that kids are affected by these population health measures. There's a loss of routine. There's a lack of access to mental health services. We know that school is such an important setting, one for connections and education, but also as having another pair of eyes on children and being able to flag kids who might be experiencing vulnerable situations. And so we're aware of that and concerned that that is a piece that's been missing for kids. And so we're really thinking about that as we move forward and thinking about marrying that science and epidemiology, what we've learned about kids and COVID 19, and using that to inform all of the pieces as we move forward. If any of you were able to watch Dr. Henry's briefing last Monday, she talked a lot about the key principles that are underpinning all of the steps through into this new phase and this go forward. And so her first principle is to encourage people to stay informed. And really, I think I can speak very confidently on her behalf in terms of how grateful she's been and how honored she feels that British Columbians have really taken her messages to heart and, taken them forward into the world, and in some instances even taken them beyond what she's recommended. It was quite funny. My family and I went for a walk on the weekend. It was so sunny, and we went past somebody on the sidewalk, and she shouted at us while she was waving her arm about social distancing, and I just kind of had to giggle because really that passing by somebody outside is an extremely low risk. And I thought, oh, I bet this person hasn't really thought this fully through, that actually by shouting at us, she's actually increasing the risk. But I really, have to admire, and really we do take to heart that people are taking this so seriously. So we hope that people will continue to stay engaged through all their various channels, reputable channels of information, to really learn about that science, just as we've done today, to think about the science specific to children and allow that to guide these next steps forward. The next piece, of course, is continuing to practice this excellent hygiene that people have been doing. So the frequent hand hygiene, the cleaning and disinfecting. One piece that we've learned, and again, this has been such a learning curve for everybody, but we've been dialed in very much to the science happening outside of BC, but then very much following the data here. And as you will have heard in the media, there were a couple of outbreaks in poultry processing plants on the lower mainland. And that really illuminated for us a very important gap, which is that people need to be supported to stay away from others when they're ill. So we need to get into a culture shift, a paradigm shift, whereby when we're not feeling well, we stay home or we stay away from others. And so that piece is going to be so critical in terms of this new normal and living with COVID 19 and preventing a big resurgence. Maintaining physical distancing outside of the home is going to continue to be, a huge piece. So as we go into this new phase, not shaking hands, not hugging people outside the family is going to be an important change. Making contact safer, and I'll go through an image in just a moment, increasing cleaning at home and in work, and then continuing to reduce non essential travel. So I'm just going to check in with the media folks to see if it's possible to put up the hierarchy of controls. I sort of sprung this on them this morning. I came in with some images, and they've got a very high tech operation here, which I love. And so I'm grateful that I'm hoping you can also see this hierarchy of control. So this is also from Dr. Henry's briefing last Monday, and it's a really helpful image, I think, that is Western science based. That goes through what are the most effective ways of preventing the spread and reducing the spread of COVID 19 down to the things that are less effective. So, at the very top of the pyramid is physical distancing. So that's that idea of staying at a distance of 2 adult arm lengths away from people when we're outside of the home. And that is really, really critical. As you may recall from previous media or when I was speaking last, COVID 19 is spread through infected droplets that can travel a maximum of 2 meters, those 2 adult arm lengths. So as long as we're keeping that distance from people, um, we're not likely to transmit COVID-19. So that above and beyond everything else is such a critically important measure. What's not included on this slide is the personal measures as well. So still thinking through that frequent hand hygiene, not touching our face, and frequent cleaning and disinfection. Those are all things that wrap around physical distancing. And now we've seen in BC how effective that is. So we've all watched together how by implementing this across the province, we've really gotten ourselves into a really amazing place. Just below physical distancing are engineering controls. So that's things like the plexiglass. I had to make a trip to the hardware store this weekend, and they had taken 2 dowels and used sort of that clear, transparent window film to hang down. And that was very effective, very inexpensive. And when I commented on, they said, yeah, we're a hardware store. So of course we would come up with something like that. So those are the types of things, physical barriers to help make our contacts safer. Below that are administrative controls. So those are all the policies and guidelines and cues, things like the tape and boxes on the floor that remind us where to stand. Um, Thinning the number of people that might come in. So, thinking through a grocery store, limiting the number of people that can be in a store at one time. That's an administrative measure that helps to promote physical distancing. And then at the very bottom of the inverted pyramid is the personal protective equipment. So outside of healthcare settings, personal protective equipment can have a role to play, but it is much less effective than all of the things that we've talked about before that. So, in instances where you cannot have, or you need to have close contact and there isn't an engineering control that can be put in place, then a personal protective equipment, a homemade mask, may help to keep your infected droplets in. So, it may protect others from you, but it's not likely going to protect you from others. So that's why we want people to still keep all of those other considerations at the forefront. And then, if it's possible to bring up the next image, thank you so much. So, this 2 by 2 table is really so critical to thinking through how we're going to expand our contacts and our social interactions and bring different sectors back online, and how we can do that in as safe a way as possible. So, what this 2 by 2 table is really showing us are the two variables that determine the risk of transmitting or spreading COVID 19. And those two variables are the number of contacts, so the number of people in a setting at the same time, and the contact intensity. So, how close and how long are people together for? So, this is a tool that people are going to be encouraged to use going forward to think through in their particular circumstance what services, what activities are happening in that setting, and where do they fall on this matrix. Is it an activity where there's lots of people together in a small space, and they're in close contact with one another for a long time, which would then put them in that higher risk corner of the matrix? And then that allows people to think through, okay, that's a high risk activity. What are the things that we can do to make that safer? So, how can we decrease the number of people in that setting? Is it an activity that we can split up into smaller groups? So, rather than having 20 people come together for this activity, can we repeat this activity in groups of 3 to 5? Can we hold the activity in a larger space so that when people are together, they actually are at more of a distance from one another? And then, are there engineering? Are there ways that we can have the activity happen with physical barriers? So, if we think, for example, of daycare settings and naps, is it possible to get the kids sleeping head to toe, and or actually putting barriers between cots and cribs so that there's not that close proximity for a prolonged period of time? So, if we can bring up my speaking notes again, that's great. Thank you. So, I just wanted to speak briefly to the announcements that were made last week. There was an announcement by the Premier on Wednesday talking about phase 2, the sectors that will reopen. I really want to acknowledge that the incredible work that you have been doing through all of this, through this whole phase. You are an essential service. You're providing care to some of, the children in the province that face the greatest vulnerabilities. And so you're already doing this, and we're acknowledging that we want to support you. And also, as the rest of the economy comes back online and other activities are coming back online, that you're a part of that as well. And so, what's shifting as we move into this next phase is really three pieces. So, thinking about what can we as individuals continue to do to decrease our risk of getting COVID-19. So, the frequent hand hygiene, cleaning, disinfection, and thinking through our personal risks. So, for somebody who's over the age of 65, or we have chronic health conditions, or we have somebody like that in our very close immediate circle, we may choose to limit how much we increase that social bubble just to keep our risk pretty low. The second consideration is that social interaction and that social bubble. So there was talk about, we most of us have been staying at home with our immediate family, and now we can see from the statistics and the modeling that's probably, we've probably collectively all reduced our contacts to about 30% of what we would normally have be doing. When we look at those same statistics and modeling, so that's what we've been doing. When we look to see what we could do in the future, it looks like we could probably increase our social contacts to about 60% of what they were prior to COVID and still keep ourselves in a fairly flat part of the curve. So that's where many of you probably heard the number. We can expand our social circle by about 2 to 6 people. There's no science in that. That was just an example. And I know a lot of people have gotten very hung up on, oh my gosh, does that mean if there's a seventh person in this family that we wouldn't include them or we wouldn't resume? There's no specific hard and fast science around that. It's just trying to help people understand this concept of we've been in these smaller bubbles. Now we're going to expand them a little bit. And that this is, that each time we expand our bubble a little bit, we're connecting to another bubble. And so we just want to be mindful of that so that we don't end up connecting ourselves to so many different bubbles that we're actually now in a very large circle. Um, and so that's the second consideration. The third consideration is workplaces and sectors and how can they scale up services, resume certain services or activities that are really essential to the well-being of the people that they serve, and how can they do that in a safe way. So that really is thinking through that 2 by 2 matrix. So obviously there's a lot of science that's underpinning this. The principles themselves are quite straightforward. However, the interpretation and implementation needs to be nuanced, and each sector is being tasked with developing their own plans because they know their sector best and they can think through that 2 by 2 table and think through some of the modifications that need to happen. That said, there is a structure that's been developed to support sectors to do that. So, WorkSafe BC in phase 2 is really stepping into a leading role. They are developing sector specific guidelines and protocols that are going to provide guidance to different sectors on how to develop plans to reopen or scale up services in a way that's safe. They're doing this in close collaboration with public and population health. So, WorkSafe BC has a mandate that's specific to the health and safety of employees. Population and public health, as the name would suggest, is really thinking about the population and the public's health. And so we do need to have close collaboration there so that everybody's health and safety is being considered. And so WorkSafe BC is the lead in developing the guidance documents. Public health and the regional health authorities are reviewing those documents to ensure that they meet the public health principles. The one area that I want to flag also is that there are certain sectors that fall directly under the purview and guidance of population and public health under the Public Health Act or the Community Care and Assisted Living Act. So, in those scenarios, then public health and the health authorities will be continuing to provide specific guidance and direction. The documents that I've just been referring to are being developed as we speak. They will be posted publicly on WorkSafe BC's website either tomorrow or Thursday. There's also an overarching cross industry document that's being developed that will review the 6 steps to ensuring a safe workplace during COVID 19. So I just wanted to give you that sort of behind the curtains look at what's happening because I know that the Premier made his announcement on Wednesday and then all kinds of phones started ringing at WorkSafe BC, at health authorities, and everybody, of course, wants to know what does this mean for me? What does this mean for my haircut? We're all so desperate. But truly, people want to know and drill down to the specifics. The intent of phase 2 has always been that something that would get underway in mid-March. And so that's why WorkSafe BC is working around the clock right now to get those guidance documents up in the next day or two so that starting next week that we'll see a little bit more activity and resuming of services. Some examples of what you may see specifically around schools and childcare. I just want to briefly touch on that and go back actually to March. In classroom instruction was suspended. As you know, schools and online curriculum was developed. The intention from the outset was always that there would be in class space for children of essential workers and children who may be facing vulnerabilities and really need that additional support. It didn't fully materialize, probably for a lot of different reasons. But if you're looking through some of the briefings and what was announced, you'll see that the reopening of schools is really slated for the fall. However, there is a concerted effort right now to bring back a number of children that we see in those categories of those who are facing challenges, vulnerabilities, those who are really needing that in classroom instruction in order to keep pace with their learning, and children of essential workers. So there is a lot of work happening right now for education specific guidance, and again, thinking through how can we bring kids back into the school setting in a way that's safe. Thankfully, again, we've reviewed the science of children in COVID-19 earlier, so we know that they're not great amplifiers. They don't tend to get COVID-19 as often. They tend to be less sick, and they don't tend to spread it to adults. So those are all things that really help us as we try and move into that phase. And as you're watching these documents come online, some of the examples of things you might see across the board is just discouraging individuals who are ill from coming into child and youth care settings or settings in general. So that's going to be a big theme that you're going to see across the board. Promoting and facilitating personal public health measures. So having lots of hand hygiene sanitations, having lots of cues about screening and those types of pieces, lots of on the ground cues to help kids remember how to maintain physical distance. Um, Understanding that the concept of physical distance is challenging for kids, there's going to be a lot of emphasis on no physical contact. So keeping your hands to yourself and those reminders. And finding ways to promote physical distancing. So, again, smaller groups of kids together, staggering recess and lunchtime, just thinking through how can we thin out those that contact, the number of contacts and the contact intensity, creating physical barriers, mitigating risk from exposure to high touch surfaces. So again, there's some really simple things thinking through propping doors open, having that frequent cleaning and disinfection of high touch surfaces, mitigating risk for people at higher risk for severe illness. And I know that that's a consideration in your setting and thinking about those people who are at higher risk in our circles. My dad lives here in Victoria as well. He's 70, and so it's been really hard on all of us. He and my daughters are very, very close. This weekend, we took advantage of the sunshine and went and had a picnic, and he had his blanket and we had ours. And we kept our distance with frequent reminders on my part. But that, in my mind, was, it was just such good medicine for all of us. And it was very, very low risk. And so thinking through, how can we re-engage with those people, our elders who are so critical, and do it in a way that's really safe and respectful for them. So it can be done. We just need to get creative in terms of how we do that. And then again, modifying practices to reduce how long children are in contact with each other and how frequently they come in contact. So thinking about, just how we stagger things, the types of projects that kids do and the activities that they engage in. So not so much group activities and focusing on how they can do activities that connect them. So maybe having theme days where they all wear something similar, but not necessarily requiring that close physical contact. Um, I haven't, I think I actually have touched on a lot of the questions, and I will specifically look at those in just a moment. But I do want to acknowledge that the questions that you raised did speak to your concern for those unintended consequences for the emotional and the emotional mental health impacts of COVID 19, not just on children, but on all of us, but specifically on children. And I wanted to make you aware of a working group that's been developed and stood up. It's the Unintended Consequences Working Group. It sits under the Office of the Provincial Health Officer. And what we're trying to do is develop a very holistic, eagle eye view of the various impacts across health, social, economic, mental health, cultural impacts of COVID 19 and the population health measures. um, I think that the sector that you're working with, working in the children and families that you're working with, are a group that are so critical for us to hear from and understand what your and their journeys have been throughout COVID 19. And so I just want to flag for you that at 3 o'clock this afternoon, Dr. Henry is going to be speaking to a population health level survey that is it's live as we speak, and in fact it's called BC COVID-19 Speak. I'm just going to read for you the introduction. So, your story, our future, is a population health survey to understand citizen experiences, knowledge, and actions during the COVID-19 pandemic. This survey is the first of several activities that will strengthen our pandemic response and our understanding of the impacts of COVID 19 to date: social, economic, mental wellness, and community wellness. And so you can find that survey at www.bccdc.ca COVID-19 survey, all one word, no hyphen. And Dr. Henry will probably have that up on a big screen behind her this afternoon when she speaks to it. If you can take the survey, if you can spread it through all of your different channels. Where I'm particularly interested to hear from the experiences of First Nations, Inuit, Métis children, families, and care providers, since we know that as a result of colonial practices and policies, we carry a heavier burden, and that we came into this pandemic on unequal footing. So there will be an opportunity for participants in the survey to self identify. And we are observing First Nations and Metis data governance principles. So any data relating specifically to Indigenous peoples will be analyzed and disseminated in a way that includes in meaningful partnership our First Nations and Métis stakeholder groups, FNHA and Métis Nation BC. So thank you so much. I, of course, have been not paying attention to the time at all. But I'm going to take a moment to look specifically to the questions that you asked. And thank you for your patience in waiting to get to the questions. So in-person visits, question number one. At a group home that have 4 residents as well at one given 3 support staff, love to have scheduled visits with families. There can be 4 to 5 people in a family. So, in total, at one given time on a scheduled visit, there could be 12 people. Is this allowed? So that's a great question and comes back to, the statement that there's no firm science around a specific threshold of a number, with the exception again of the no mass gatherings of more than 50 people. And again, there's no specific science around that number. It's just the number that was chosen because it was our best guess. Um, but what I would say is that if you can take into consideration that hierarchy of controls, that 2 by 2 table, and sort of think through those visits and think through, okay, is there anybody who's high risk in that visit. So that would include anybody over the age of 65 or somebody with chronic health conditions. And in that setting, then I would either encourage that person to not participate in the visit and or participate on their own picnic blanket. Again, elders on their little island. Um, that's one thing I would consider. I would also consider, are there ways to still promote physical distancing in the visit? So again, we're so lucky to be living where we live, and be going into a season across the province that's going to give us more opportunities to gather outside. That's really one of the safest places to get together if we can maintain physical distance. One, because the space is there. Two, because the UV light helps kill COVID-19. Three, because there's lots of air exchange because we're outside. So those are things that could make that safer. And then the other consideration is just thinking through again, just those bubbles and trying to be mindful of not increasing the bubbles too much. Um, we get to stand fairly confidently in that science around kids and COVID. So the kids aren't really the high risk variable in those get togethers. It's more the adults. So the more that you can ensure that the adults stay apart from one another, the better off and the safer that particular visit's going to be. And you'll see that as schools and childcare settings come online, that the emphasis is really going to be on pickups and drop offs. Like we want to stagger those out because the highest risk thing is going to be me standing right next to another parent when I drop my daughter off at daycare. It's not so much going to be my daughter and her interactions. Question number 2, are we allowed to resume face-to-face visitation of child and parents? What are the safety measures and precautions needed if we want to allow house visitations? And are there safety visitation guidelines specifically adopted for immunocompromised clients? So I think we've actually addressed all of these throughout the presentation. As Corey mentioned, the March 26th visitation guideline is still in effect. However, it's in the process of being revised and will come into alignment with these sector by sector guidance documents that will be coming out tomorrow and or Thursday. The safety measures and precautions, again, just go back to that pyramid. That is the gold. That really tells us what we need to do and where we need to invest our energy and time. It's really in physical distancing. If we can put up physical barriers, great. And then those administrative cues, the guidelines, the policies that we put in place to make sure that we're limiting the number of people that are getting together at any one time. Safety visitation guidelines specifically for immunocompromised clients. Again, we're encouraging sectors to think that through, and that's one of those pieces that is going to be quite individual specific and driven in the sense that people are going to think about themselves and how to keep themselves safe from COVID-19. And somebody said it quite well yesterday. I think it was the Deputy Minister for Ministry of Social Development and Poverty Reduction, and he just acknowledged, that this is not going to be a fair process. So this next phase 2 going forward, it's not going to be fair because our risk is not equal. And so some of us are going to be able to go out and resume more activities and social interactions, and others, because of our own health, are going to need to keep our circles a little bit smaller. And so I thought that was such an astute observation. And sometimes it's important to just say those things right out and acknowledge that that's the reality. However, again, I'm really pushing this idea of picnic blankets. That is one way that those who are at a higher risk can still enjoy that connection and keep themselves safe. Question number three, we have a scheduled physiotherapist that was coming in weekly to do physio as childcare. Is this able to start up again? Wonderful question. Physios, chiropractors, dentists were all named as part of that phase two list of sectors. That's all available on the WorkSafe BC website right now. So you can go and look. Hair stylists are on there. I've mentioned that already once. That's where my priority thinking is going. But physios are definitely there. So they will have a sector specific guideline protocol coming out from WorkSafe BC in the next couple of days that will allow them to adapt their practice to make sure that they're practicing in the safest way possible. I didn't mention, and I should have, um, there is no approval process. So there's no specific approval that any given industry or setting will need to get in order to resume the service or expand their activities. Everything is happening with these sector level plans. Those sector level plans are being developed by WorkSafe, being looked at and vetted by public health. And so those really are the place that people are going to develop their own individual plans. And individual plans do not require a specific approval. The last question was, what are MCFD instructions for children returning to school? So that again is a document that is just in the final stages of being approved and will be made public. And so there will be specific guidelines and considerations. And I touched on earlier just what some of those considerations will be around physical distancing and all of those administrative measures that can be put into place to stagger out the number of kids that are coming in contact and decreasing their contact intensity. So I think that I've managed. I'm looking down. I'm hoping this clock is correct, that I have not exceeded our time together. Thank you so much for the work that you're doing. I can't, yeah, really from the bottom of my heart, I'm so grateful to everybody who kept showing up and doing their work in a good way, especially at a time where there were so many unknowns and we were all holding our breath to see what would manifest and what would transpire. I'm so grateful to everybody who has taken these population health measures to heart and worked together, come together with one heart, one mind to bend the curve. And we've gotten ourselves into a really good place here in BC, and really grateful to people for their patience and willingness to move forward in this stepwise measured approach so that we can keep ourselves in this flatter part of the curve and really learn how to live in this new COVID-19 normal together. So I look forward, as you do, to seeing all the guidance documents that are going to be coming online in the coming days. And I'm really happy to come back anytime if there comes a point where it would be helpful to have a gathering like this again. And I will leave it at that. Masicho. Haichka.